Today is World Skin Health Day, and we're gonna go do a free dermatology clinic in the motorhome. Kind of a tight fit to get up here, but there we are. Let's go. I'm still getting used to how to drive this thing. So we're on our way to the Friendship Clinic. This is a free and charitable clinic here in Boise. The only people that can go there are those without any health insurance, and usually they don't have a lot of money, so getting specialty care is almost impossible. We're doing this as part of World Skin Health Day. This is an annual day started by a couple different organizations, and this year CeraVe is a corporate partner. So I just pulled into the Friendship Clinic. We're here about an hour early because I've got to get everything set up. And when these patients come in, we're not taking any insurance or financial information. We are grateful for a sponsorship and a partnership with Frontier Credit Union. They believed in our mission, and they are helping us to basically get insurance and gas in this thing for the next while, and that's a huge help for us. So let's get set up. All right, we're level. Now let's go set up the rest of the motorhome. I just want to show you, we've got a wheelchair lift here, so this door will open up. We can get people in with accessibility needs. Slide out moving, and then we'll get this all organized. All right, we are all set up with the motorhome, and the first patients are starting to arrive, so let's get to work. So it's not a mystery that it's not easy to get any medical care in the United States, let alone specialty care. Derms across the country are going to be at NAFC clinics today providing care. We've got samples here. The staff just put on sunscreen, so I liked seeing that. We're just glad to be here doing something good. All shiny. All right, Ivana, how long has the Friendship Clinic been here?
This October will be our 20th year. Marie Blanchard saw a need in the community as she was a nurse in many different areas and fields. And she saw that there were families, basically the working poor, that were falling through a gap. Yeah. It was, providing food and housing for their kids and no medical insurance or anything, unable to afford it. We opened the Friendship Clinic back in 2003.
If somebody watching, and I can't make any promises, wanted to support Friendship Clinic in any way, how would somebody go about making a donation?
On our website, we have an area that you can donate. You can make a call. You can send us a check any way you'd like. We're here on the bench and have been for a while, so yes, donations are appreciated. Okay, well, we'll make sure that information gets all in the video description. Thank you.
And I hope that you're able to get some donations from that. Patient 1 had a condition called post-herpetic neuralgia. This happens after somebody has shingles. You get shingles if you had chickenpox as a kid, but now that we've got the chickenpox vaccine, there's less chickenpox, and therefore in a number of years there'll be less shingles. But when you get shingles, it's a reactivation of that same virus, and it comes out along one of the nerves. For this patient, it came out from the spine, on the shoulder, and down the arm. And even though this happened over 6 months ago, it can leave this condition called post-herpetic neuralgia, which causes a lot of itching and sometimes a ton of pain. So with the last couple patients that we've seen, we have not had anything like remarkable on the exam, but one of the important things that we do is just provide reassurance, because they don't have expert dermatology opinion accessible to them easily. So the fact that we're able to just come in and tell patients whatever this thing is totally fine really does help their health, because the skin problems that they think they have can contribute to anxiety or other mental health issues, or just give them more confidence to go on with their daily life without having to worry about something. So even when we're not doing a whole lot, just providing reassurance is a huge help to a lot of patients. Tell me a little bit about your history. You've had some skin cancer before?
Yeah, I'm from Arizona, being out in the sun a lot.
Yeah.
And not doing the proper stuff that you needed to do. I had good insurance back then, worked for the public schools, so I had some spots that were bothering me. Then I ended up going to a dermatologist, and he found some spots. A lot of them were basal cells. Yeah. They cut into my neck for one. He educated me, and then I think I was every 6 months to a year for checkup. And every time I went, they found more and more.
Yeah. You got a couple spots you're concerned about today?
I am. One on my neck, shoulder, and my chest right here.
Okay. So these spots do look like actinic keratoses. So I would freeze a couple of those. And then you got a bump on your nose. Have you noticed this one here?
I do, and it
Yeah.
hurts.
Yeah.
I don't know what the heck that is, but it hurts.
So I am worried about that one being a basal cell carcinoma. There's a spot there that needs to be frozen.
And I think there's one on my other ear too, but I'm not sure.
And this spot lower on your neck.
That hurts.
Yeah, that
really
one's
bad.
Probably another basal cell, to be honest with you. I see your old scar. Josie, do we have a marker? 9 skin cancers, 9 probable skin cancers on that patient, and I feel awful for him just because he hasn't had access to care, no insurance. Recently started a business, so hopefully that'll take off for him and he'll be able to afford care. But until that happens, we're going to make sure that we take care of him. This is why we're here, for people exactly like him. Last couple of patients, one was outdoor worker, lots of sun damage, a couple potential skin cancers that we biopsied. But our other patient has recently immigrated from Ukraine, fled the conflict that's going on there, and has been suffering with a recurrent rash that can pop up anywhere on their body for a number of years, since they were 16, and they're now over 60. So it's a little bit, perplexing. It's not something that was really amenable to a biopsy today. So we're treating this according to a presumptive diagnosis of disseminated zoster or shingles again. So that's the second time we've seen that today, but that's what it looks like clinically. So we're getting them some generic medication that hopefully is going to help to keep that from flaring up so bad, or that if it does start, they can get right on treatment quickly. Very important work that we're doing here, and thank you guys for your support in watching the videos, purchasing any of your products through the links that we have here. All of that helps support us going out and providing as much free care as possible. And if you do feel like a donation, if you don't need to buy a product, we'll have links for that as well. And anything that you do give certainly helps us to provide care, because some of these patients need significant follow-up care. Some of them are going to need surgeries that can, at retail, with insurance, can cost $2,000, $3,000, sometimes more, $1,000. So thank you for all of your support. Just watching the videos is a big help to us. All right, so we are done with the clinic. That was kind of an intense clinic with some complicated patients. A lot of skin cancers that we found. Plus, our generator went out and we didn't have AC for most of the time that we were seeing patients, so it got super hot in here. We're gonna get that fixed and we're gonna keep going on the road. Our next event is gonna be back in my hometown, where we're gonna be doing free skin cancer screenings. Your support for what we're doing means the world, even if it's just watching the videos. I appreciate it. Guys, I'll see you on the next one.